Join us at whole body counter here. We're now up to the stage where you got out of your most acute lower back pain, you've been able to free things up enough that you can walk around and function more or less normally in everyday life, but you still feel like you're really vulnerable in your back. You might be quite stiff, and every so often you get an ache or a pain. So at this stage in your care program, we really want to get down to addressing the underlying causes of your lower back pain. So I put together a bit of a program. There are 3 steps to it. The first step, we're going to do a bit of a warm-up and increase that movement awareness in your back so you get better control of your movements. So we're basically going to run through all the different movements that your back can do. So starting to the side, other side, look up, just relax forward, and rotation. So do all those directions 5 times. Once you finish that, we're going to move on to some stretches, starting with the hip flexor. So just kneeling down here, and from here I'm going to collapse this hip forward to the front hip, just forward like that. For the first 15 seconds I'm not really going to push it hard at all, and for the next 30 seconds after that, with each breath out, I'll try to sink a little bit lower. So breathe in, and as I breathe out, go a bit lower. So after 30 seconds, you can really push it. Just try to get your hip down as slow as you possibly could, and after that you move over to the other side. After that stretch, you're going to move on to hamstrings, which you can do from a similar position. So from here, straightening the front leg, then just lean forward, trying to keep my lower back straight, and just bend from the hip, and then feel stretch underneath the thigh here. Same thing here. First 15 seconds you just hold it. The following 30 seconds you sink lower with each breath out and get deeper and deeper into the stretch. And for the last 15 seconds you're really trying to push it and pull yourself as far forward as possible. Getting more flexible in the front of the hip and back of the thigh is going to make it easier for you to safely get down to squat and get into all sorts of movements without putting your lower back at risk. Alright, next up we're going to work with our core stability and teach you how to keep your back in a safe posture. So if I arch my stomach forward like this, that's not really a healthy posture for the lower back, and same if I crunch forward, that's not good either. So we try to find a midpoint where it's strong, and from there we're locking everything in. The muscle at the front, the muscle at the side, and the muscle at the back. So once that is all tight, we're going to start to do some different movements. Our first movement is going to be to just lunge down. So from here, I'm starting quite wide, and I'm going to dip the back knee in the mat, in the ground. So rather than just lunging forward like that, standing up straight, core locked in, and dip the back knee straight underneath my head and back up. You can do that up to 12 times, and do the other side. Nice and straight, dip the back knee. Just the other knee straight underneath my body, straight underneath the hand there. Right, so 12 on that side. The last exercise is a plank, and we're going to start to do it from our knees. So you can use a towel, something like that, to protect your knees. From here, press on all 4. Once again, I find that mid position, so not pushed out like that, and not arching too much either, but the midpoint. From there, I'm going to straighten the hip out, and just hold this position for 90 seconds. Right, that's it. So run through this program twice a day, and then I will move you on to the next stage once you master this level.